Hello everybody. Today we're going to be presenting about Sever's disease. Sever's disease presents as posterior heel pain in children aged between 8 to 15 years of age, and children that are highly active, particularly in sports including running and jumping. It is believed to be caused by repetitive microtrauma due to increased traction of the calcaneal apophysis. We'll be using the 5-step process to analyze management modalities for the treatment of Sever's disease in the pediatric population. The clinical question for this presentation was generated using the PICO format. The initial question was, what treatment options are most effective for reducing pain in the pediatric population suffering from calcaneal apophysitis? The question was divided into search attempts while exploring numerous electronic databases. We commenced our search at the Cochrane Library database. While searching through Cochrane, we limited our search results to title, abstract, and keywords, whilst using keywords such as calcaneal apophysitis and Sever's disease. Consequently, we obtained one article, which was a systematic review. Other numerous terms were investigated using the search all text option. However, we were unable to yield any useful results. Additionally, truncations were applied for words including calcaneus, apophysitis, management, and treatment. However, we were again unable to yield any results. The next database explored was Medline. Initially, we began our search using the term calcaneal apophysitis, limited to keywords only. However, that produced 0 results. Consequently, we decided to use the term Sever's disease, limited to keywords again, and that resulted in a large number of results. Thus, we decided to refine our search strategy and limit it to title only. This has a positive effect, as one related article could be identified. This was the same article identified in the Cochrane database. Whilst exploring PubMed, we activated 2 filters including published in the last 10 years and sort by relevance. We used similar search terms as previously mentioned, and that yielded a low and specific amount of results. We found 4 useful articles. CINAHL was the next database to be investigated. The same search terms were applied, and initially the search settings were open to finding all of the search terms. However, this caused a large number of results. Once again, we modified our search strategy to limiting the results by enabling the search within title only option. This led to a more specific amount of results being displayed. It is to be noted that some of the articles discovered in this database were the same as ones found in PubMed and Medline. Moving on, Scopus was the next targeted database. The search settings were limited to title, abstract, and keywords, using similar search terms as previously mentioned. However, we could not find any relevant articles. Pedro was the last database to be explored. We again used search terms as previously mentioned, and our search settings were limited to title only, studies published within the last 10 years, focusing on lower limb, and match all search terms. We were able to find one recent randomized control trial. After investigating numerous databases and journal articles, we selected 6 articles that are of utmost relevance to our study, and we consequently modified our question to address the common interventions used for the management of Sever's. The final question being, how effective are insoles and physical therapy for the management of calcaneal apophysitis in the pediatric population? The question will enable us to help identify treatment options that are applicable and also effective in the management of Sever's disease in a clinical setting.
From our search of evidence, we obtained 6 articles which included 1 systematic review, 4 randomized trials, and 1 case study. Center for Evidence-Based Medicine levels of evidence was used to determine the level of each study. Each study was appraised to determine validity of the trials. The systematic review was appraised using the criteria by Greenhalgh and Donald. The randomized trials and case study were appraised using the Pedro scale. Results of appraisal with the Pedro scale are as follows. This article by Hammer et al. Is a level 2 randomized trial which scored 4 out of 10 on the Pedro scale. The lack of control group used in the study may decrease validity of results. The study found that when insoles, which includes heel raise and heel cups, were used on athletic male participants, there was a significant reduction in pain for 2 levels of activities. Pain during activity A, which is the most painful activity, was reduced by 2.5 on the Borg CR10 scale, and during activity B, which is the least painful activity, was reduced by 2 points with a p-value less than 0.001 for both. After treatment, there was only statistically significant reduction in pain for activity B as p equals 0.03. Another article by Hammer et al. Is a level 2 randomized trial which scored 5 out of 10 on the Pedro scale. Again, the lack of control group used in this trial may decrease validity of results. The study found that when the effectiveness of heel cups were compared to heel wedges in athletic male participants, the heel cup was more effective in reducing pain during activity. The odds ratio indicates it is 20% more effective for use during both activity levels, with the true population effect between 34% and 15% in activity A and 27% and 12% in activity B. P is less than 0.001 for all outcomes, indicating statistical significance. The third article by Hammer et al. is a level 2 randomized trial which scored 4 out of 10 on the Pedro scale. The study was conducted on participants with Sever's disease to determine the effects of the use of heel cups. Again, there was a lack of control group. Outcome measures include heel pad thickness, heel peak pressure, and pain. There was a statistically significant increase in heel pad thickness when the heel cup was used with shoes when compared to barefoot, which increased by 3.57, and with shoes, which increased by 1.53, and P was less than 0.05 for both. The heel peak pressure was reduced by 21% while running and 25% while standing with the use of a heel cup. Statistical analysis was not conducted on these findings. Median pain for the treatment group reduced from 3 without a cup to 0.5 with a cup after 4 weeks. Again, no statistical analysis was conducted on these findings. The study by Wagner et al. Is a level 2 randomized trial which scored 8 out of 10 on the Pedro scale. The study was conducted to compare wait-and-see approach physical therapy and heel raise for the treatment of Sever's disease. Outcome measures include pain, patient satisfaction, and Oxford ankle and foot questionnaire for both participants and their parents. The results for pain indicate there was statistically significant improvement across all groups as P was less than 0.05. There was no statistical significant difference between the groups after 3 months as P was greater than 0.05. However, the results were in favor of heel raise with an average reduction in pain by 4.3 in the visual analog scale. Lack of statistical significance between control group and treatment groups could be due to ceased activity levels in the control. There was statistically significant improvement in Oxford ankle and foot questionnaire for both parents and children when compared to baseline. In patient satisfaction, there was no statistically significant difference across groups after 3 months, as P equals 0.27. At 6 weeks, patient satisfaction was significantly better for the heel raise group when compared to the other two groups, as P equals 0.01 when compared to the physical therapy group and 0.01 when compared to the wait-and-see group. The study by Y is a level 4 case study which scored 2 out of 10 on the Pedro scale. This indicates it's a low-quality study. The study was conducted on a single patient with Sever's disease and was treated with a combination of physical therapy and ketoprofen gel. Pain decreased by 5 points on the VAS score. The overall lower extremity functional scale score showed improvement in the patient's condition with a 24-point increase across administration. Results indicated improvement in muscle strength and ankle joint range of motion. Statistical analysis was not conducted on findings as only a single participant was used. The study by James Williamson Haynes is a level 1 systematic review. The appraisal was determined that the study is internally valid. The treatment options reviewed in this systematic review include NSAIDs, taping, orthotics, and heelers. Discussion was mainly based on studies by Hammer et al. On insoles which were previously discussed. Meta-analysis of findings was unable to be conducted due to the difference of data obtained in the studies. A clear conclusion was unable to be reached due to the lack of high-quality evidence on the treatment of Sever's disease. However, it does provide an understanding of how to treat Sever's disease. 5 articles which evaluate the use of insoles for the treatment of Sever's disease were obtained, and these included 4 randomized trials and 1 systematic review. There were 2 types of insoles involved, which include heel raise and heel cups. 4 articles discuss the use of heel raises. 2 randomized trials by Hammer et al. Used 5mm cork heel wedge in the treatment group. Results indicate that the use of heel raises are effective in reducing pain in athletic patients, and it was discussed that heel raises create an equinus position which will reduce shear forces exerted onto the calcaneal apophysis by the Achilles tendon. Another randomized trial used the visco heel in the heel raise treatment group and discovered that the use of heel raises significantly reduced pain across 3 months in the athletic patients. Although results favored heel raise when compared to the control group, there was no statistically significant difference. This could be due to the control group's cease of participation in painful sporting activities. In the assessment of satisfaction levels, it was found that patients using the heel raise were able to maintain a constant high level of satisfaction throughout treatment. The systematic review discussed the use of heel lift to reduce strain placed on the apophysis by shortening the Achilles tendon. The review also discussed results of the articles by Hammer et al. And questioned the validity of the results due to the lack of control groups and comparison between results, and advised to view results with caution. Heel raises are a cheap treatment option and are easily available through pharmacies or podiatry clinics. High level of patient satisfaction reported by Wagner et al. Indicates possibility of high level of patient compliance. 4 articles discuss the use of heel cups. The 3 randomized trials by Hammer et al. Used a rigid 2 to 3 cm high thermoplastic cup molded to each participant's feet and included an arch support. These studies concluded that the use of heel cup in athletic patients significantly decreases pain during activity, and it was discussed that it will increase thickness of the heel pad, which can reduce repetitive impact forces during heel strike. In the systematic review, heel cups were classified as orthotics due to the characteristics. The review discussed using heel cups or orthotics to correct biomechanical abnormalities which reduce tension or stress at the Achilles tendon or calcaneal apophysis. Heel cups with no arch support are cheap and available through podiatry clinics or pharmacies. As mentioned in the systematic review, heel cups used in the studies are similar to orthotics. Pediatric patients may use orthotics with a 2 to 3 cm heel cup height and arch support to manage pain in Sever's disease. This is a much more expensive option as prefabricated orthotics or semi-custom orthotics range between $100 to $300. Results indicate that the use of heel cups and heel raises are both effective in reducing pain, and that the use of either type of insole may be beneficial. Both insoles address the possible cause of pain in Sever's disease, which can include shear force applied to the calcaneal apophysis or increased forces applied to the calcaneus during heel strike. When comparing the heel cup and heel raise, it was found that the heel cup is more effective in pain reduction. The systematic review discussed the possibility of the result being affected by the use of participants who play competitive sport, who are more likely to experience traumatic repetitive impact forces, and this can be reduced with heel cups. Therefore, it is recommended that heel cups be used for patients who play competitive sport and heel raises be used for patients who have minimal participation in sport. This recommendation ensures that the cost-effective option of heel raise will be used more often than the orthotic pathway. No adverse effects were reported in any trials, indicating there is low risk. Limited evidence was available for the use of physical therapy, with only one randomized trial and one case study. The randomized trial used eccentric calf strengthening exercises, and the case study involved calf and hamstring stretching exercises. Weigerink et al. Found there was a significant improvement in pain after 3 months of calf strengthening exercises. There was no statistical significance when compared to the control group. However, it was previously discussed difference in activity levels may have affected the results. The case study reported an improvement in pain, however, ketoprofen gel was also used concurrently, which may have impacted results. Although limited evidence is available, the findings indicate consistent results in improvement of pain. Physical therapy options can include calf stretches, hamstring stretches, or calf strengthening. These exercises can easily be done when required with no cost. However, if monitoring is required, consultation fees will apply. The lack of adverse effects reported indicate low risk. However, further research will be required on the use of physical therapy and exercises available. In conclusion, to answer our PICO question, evidence for the use of insoles suggests that it is effective. However, due to the quality and number of trials, further high-level research is required. Evidence for physical therapy is very limited. However, findings indicate it is effective. Further high-quality studies on the different physical therapy options is required.